All right, now you can get a new COVID booster. Both Pfizer and Moderna have updated shots to target and the newer variants. Who needs it? Who makes these shots better? On today's To Your Wellbeing, we've got Jeremy Friends answering those questions and more. He's the infectious disease clinical pharmacy coordinator at Cone Health, and he's answering your questions about the COVID booster for the next 30 minutes or so. So first and foremost, let's kind of just go over what makes these new boosters any different than the other shots we all got.
Well, hello, Tanya. It's great to be with you today. I think the most important thing to know about the new booster is that the new booster targets the Omicron subvariants, which are the most common variants of COVID that are circulating in the United States and North Carolina today.
Okay, so it's going to target something different than the different strains than we had before. If someone started their original vaccine series but hasn't completed it yet, can they complete it with this new vaccine?
So what they need to do is complete their primary series, which for most people is 2 doses, 1 month apart. And then what they do is they wait another 2 months, and then they can get the updated booster vaccine.
Okay, so if you're
latest strain.
If you're in the 2-shot vaccination, you need to get both shots and then wait to get this booster. If someone hasn't been vaccinated yet, can they get this new vaccine, or do they need to start from the very beginning?
So they need to get the primary series, which were the original vaccines. There's a number out there now, and they get it 1 month apart, and then they wait 2 months, and then they can get the booster.
Okay, so you do need to start through the whole thing. You can't just start with the booster. That's not how it's working. All right, so then the next question would be, should people get the new booster now, or should they wait for the next COVID surge?
So that's a good question. So we really don't know when the next COVID surge is going to hit. Another thing is that it takes about 2 weeks for the full effects of the vaccines to kick in. So I recommend that you get it now or when it's convenient for you. Then you'll be protected sooner rather than later. And the COVID variants, the Omicron variants are with us right now. So I think it's good to get protected as soon as you can.
All right, so you're saying even though you're not seeing a surge, you are seeing it in our community. So go ahead and get it. All right.
Right.
So who is eligible for this next booster?
So people 12 and older are eligible. So there's 2 versions of the booster. One is made by Pfizer, that's for patients 12 and older, and there's another one made by Moderna, and that's for patients 18 and over. Mm-hmm. And you can get this new booster after you're fully vaccinated, even if you've had a booster from the primary series.
All right,
you just have to wait 2 months. Yeah.
Okay, and you gave those ages, kids under 12, they can't get it yet. So should parents wait for another vaccine, or should they move forward with whatever current vaccine is available for their kids?
So for patients under 12, they can still get the primary series, and also the CDC does anticipate that the new booster will be available for patients 5 to 11, maybe as early as next month.
Oh, okay. As early as next month.
As early as next month, yeah. We just have to wait to hear from the latest CDC guidance on that.
All right. Now, should people expect the same kind of side effects with the boosters that they maybe got with the first or the second shots?
Yes, I think you're going to see the same types of side effects. The booster vaccine is very, very similar to the primary series that we're used to. So patients can expect body aches, chills, maybe some fever, headache. Generally, they're mild for most patients.
Okay. It's good to know what you're up against when you're going to get it, so you know what to expect. All right, let's talk about where people can get that updated booster, and do they have to register with Cone Health to get it?
Yeah, so you can get the booster at Cone Health, and we do recommend that you get an appointment. People can get an appointment online at a Cone Health facility if they go to conehealth.com/vaccine. Patients can also look for other locations to get a vaccine. If they go to vaccines.gov, they can type in their zip code, and then they can get all the locations in their area where they can get a vaccine. Several pharmacies in the area do carry the vaccine right now, and there's many appointments available.
Yeah, be patient because, those places are packed as people are trying to make those appointments and that kind of thing, but it's all there. So it's also flu shot season. Can you get both shots at the same time?
You sure can. The flu shot and the COVID shot together, they don't negate each other, so they're both effective if you get it at the same time. So you can save yourself some time if you get both the flu and the COVID booster or the primary series at the same time.
And you usually get one in one arm and one in the other. You don't get two in one arm.
Usually that's the way it goes, yeah.
Okay. All right. So now is your chance to ask Jeremy your questions about the vaccines and the boosters. You can text us that question. Here's how you do that. You text your question to the number that you see on your screen right now. That's 336-379-5775. Your questions are anonymous. You get your question answered in real time. And we're starting to take your questions when we come back from this break.